Peter, tell me a little bit about this project. Tell me where it evolved from.
Um, we were watching a documentary on Captain Tom, and we were hugely impressed. And it started with his deciding that this was a good cause of recognizing healthcare workers, and he was going to do something about it. And he was asked how much money he thought he'd raise by taking his walker around his garden. And he said maybe $1,000 on a good day. And the documentary then went into say $36 million later, he and his family created a global program for tree planting with the same objective in mind. And so Mike and I came to the conclusion that we could do this locally, because one of the difficulties was that there's been plenty of recognition of healthcare workers, but they've invariably come from a political level or from senior medical officers of health, for example. And the likelihood of that kind of recognition filtering down to the actual service providers was probably remote at very, very best. So we thought that if we could generate something locally, which was centered on the concept that we would be close to the people who actually delivered the services. And then we ran into a problem or a challenge that there are simply too many of them and we didn't have the reach. So we thought, all right, we'd pick a small group of organizations whose members were actually the service providers. So the healthcare unit was one, the paramedics were another, community care a third, and that we would enlist the help of the media if they thought that they were interested in spreading the word to a wider community. And that's really the background. And
So the idea came from Tom,
the idea came from Captain Tom,
and then it's blossomed
and
from
then
there.
it just
to today.
it blossomed from the fertile imagination of a couple of us.
So just tell me what you think of this.
I think this is extraordinary. I think it's a great tribute to all the healthcare providers. I want to pass it along to the frontline staff, because those are the people that have been out there day in and day out throughout this COVID-19, working on the streets. And this is truly is such an extraordinary gift to them. And it's my hope that I can pass this on to all the paramedics, as well as to all the other healthcare agencies throughout Northumberland County. I think one of the neat things about COVID, or a positive thing, has been the collaboration and inter-department services networking. And this shows you today. All these people together supporting our community and keeping our community safe through these COVID-19 times.
Last question, just a general one, but I mean, more than anything that I can ever think of, COVID has been a strain on emergency services, physical, emotional, mental capabilities or status, if I can use the right words, if you can talk a little bit about it.
Absolutely.
It's draining.
Yeah, for sure. I mean, we never thought we were going to be going on this long and this amount of time. And you know, the frontline staff, they've done a tremendous job. The workload's gone up. You know, you see on these hot, humid days of humidex levels in the 30s, and they're putting on their gloves, the gowns, the masks. And it's hot. It's hot, and it's wearing on them. It's also, like you say, the emotional, the mental is very difficult. Long calls and seeing people that we care about. In the community. And I think so much is important is the vaccination. Go and get vaccinated and help us protect each other and ourselves from this, and our family members.
Tell us what you think about today's service.
So I think this was a very thoughtful gesture. We're very appreciative of the support and the comments that we've had from community members. I know that all of our staff at Haliburton Kawartha Pine Ridge District Health Unit have been working incredibly hard since the beginning of the pandemic, and so any gestures of thanks are really appreciated.